like I make less money for actually promoting these ideas.
All right, and welcome back to The Price for Paradise. My name's Woody, aka Creston Woods, and with me today we have my man Chad Cherington with Ironwood Cancer Research Center. He's an oncologist and he's a great guy. And thanks for coming on the podcast, brother.
Yeah, thanks for having me, Woody.
Chad is one of my clients, and I have a lot of cancer patient clients that have lots of questions for me, and I am not the expert, so I grabbed Chad here to bring on some, more information from someone who's actually trained and sees it every day.
Yeah, so I've been a medical oncologist for over 9 years now, and I have a focus on lifestyle medicine in cancer prevention and cancer treatment, also focus on cancer nutrition, exercise oncology, and so I've been working with Woody for about 4 years to try to improve my health and come up with strategies to kind of help my patients out.
And over the years, Chad has made tremendous progress. Chad, where do we start, and where are we now?
Yeah, so I felt like I needed to make a change about 4 years ago when I went on a vacation in Michigan and did not feel good in a swimsuit. And I'm 5'7", so I'm not very tall, but I was pushing close to 200 pounds. And so then I decided to start changing my diet, start exercising regularly, and I figure I've lost at least 40 pounds of fat and gained at least 15 pounds of muscle or more in that time frame over the last 4 years working with Woody. Just a few hours a week usually.
Yeah, I know. Don't let Chad undersell you. The dude he's probably the busiest guy I know. He'll come to me twice a week for an hour, hit it hard. He'll go to this Legree class called MegaFit with our guy Jerry. Then he'll work out at home. He's got all the bells and whistles at home too. He's got red light therapy. He's got it all. So Chad, don't undersell yourself, man. You do everything and anything. And he also works long hours at the clinic, and he's always seeing patients all day. I don't know how he does it, but if you ask a busy person to get something done, they'll get it done, and that's that guy right here.
Thank you. I appreciate it.
All right, Chad. So let's break into what you see on a day-to-day basis. First off, I'm a big mindset guy, and so what are some mindsets that you see for the patients that do better than the other patients, or some emotional states that they come in with you, and if they're under control of it, is it better, is it worse? Can you give me some of that?
Yeah, there's a lot to dig into, for mind-body connection, and that's not only positive thinking, but then also goal-oriented, positive directions, and people who can achieve those things, generally do better. We do have an epidemic of anxiety, depression, loneliness in our society, and that while it doesn't always I may not be able to tell you a direct correlate to things like cancer, which I treat, but there's a lot of indirect evidence showing that it affects your overall health and well-being, and so that is a critical component to health.
Yeah, and then I see cancer patients every day, and the ones that I see having a better time are the ones who kind of go through all the routes that you're talking about, like the holistic side of things. And so cancer nutrition, cancer lifestyle. What can like a cancer patient do day one they get their diagnosis? What is the first thing you want to add and get going priority wise to help manage what you've just kind of heard of?
Yeah, there's always that baseline assessment, of overall health, and we call comorbidities, other diseases. There's overall strength and mobility, in their body, their diet, their nutrition. So you want to get that baseline, and then you want to assess what is the severity of cancer baseline, risk of morbidity, mortality, that's complications to your health or your lifespan, based on your health and that cancer type. There's a lot of assessment there, but then once you get that, then you can come up with a detailed plan. And a lot of that, as an allopathic MD, medical doctor trained, we do have all the standard treatment approaches that we go through. But the thing that I bring to the table too is integrative health aspect, lifestyle medicine aspect. So we're looking at things like in lifestyle medicine, the keys are you having a good diet? Are you getting adequate exercise activity? Are you getting restorative, adequate sleep? Are you taking care of yourself? And also,
is that crazy that all the things I ask of my patient or my clients are the same things that they're going to tell you at
Yeah, definitely. Yeah, I mean, it's the same principles are apply to any age group, any condition. any walk of life, even people that are don't have a disease or health. It's always important and it always helps.
Yeah, and so there are many different types of cancer though, right? And so do you specialize in a specific type of cancer, or
Mhm.
is there like I mean, cancer is such a blanket
Mhm.
term,
Yeah,
right?
so a lot of times, we're all medical oncologists go through the same training. We all get are trained in treating every type of cancer. But then over time, because of cancer's complexity, a lot of us will subspecialize. And so I've subspecialized, and my primary cancers are what we call genitourinary cancers. So that's going to be prostate, kidney, bladder, testicular cancer. But then also, I do all skin cancers, and I do a type of cancer called sarcoma, and those are more rare cancers of muscle and bones.
Awesome. And I'm glad you
Mhm,
brought up that you talk about the skin cancers. And so I have to
mhm,
ask,
mhm,
what are your thoughts on sunscreen? I
mhm,
am not
mhm,
necessarily a big proponent of sunscreen. I'm
mhm,
a big proponent of going out and getting, as much sunlight
mhm,
as you can without burning
mhm,
and kind of building up a layer. And
mhm,
I feel like after living in Hawaii, that was very easy for me because I was just
mhm.
outside all the time at the beach.
Yeah.
But I do believe that some days, like there's a big exposure days, and if you are doing
Mhm,
a whole beach day, that might be the
mhm,
time and place for
mhm.
sunscreen. But what are your
Yeah,
thoughts?
yeah, and a lot of this too. I don't want to overstep any dermatologists, because they're going to be a lot of the experts in this. But as treating the skin cancer as well, there are studies that show if you don't get enough sunshine, you may actually increase your risk of not only skin cancer but all cancer types. So there is a tremendous health benefit to getting enough sunshine in your life. And so where the harms come in is not necessarily the quantity, but the severity of sun exposure, meaning what is
Ooh.
that UV index?
Oh yeah, so like
Mhm.
throughout the day when the sun's overhead, it's got a different solar angle than like say at sunset and sunrise, right? And so, what day like what's a bad UV index, and like what are we looking at there?
Yeah, so the UV index scale, if you can, on a lot of different applications or phone apps, or you can actually buy UV bracelets that will kind of detect the UV index, but they go in these parameters, usually a 1 to over 12. And typically, when you start approaching 6 or higher, you start increasing your risk of sun damage, sunburns, and skin damage from UV light. And that's where the increased risk of cancer comes in, the duration of exposure and the severity of damage to the skin.
Isn't there something that we do need some of that, like UV blue light, like we do for like vitamin D production and something like that, right?
Yeah, we definitely do. So I don't tell people to avoid the sun. It's just more sun smarts. And
Yeah.
so, one of the biggest keys is the sunshine has infrared light as well, and the infrared light and near infrared have tremendous health benefits that we're learning more and more about. And so, but for example, if you are outside, say we're in Arizona, it's 100, 110 degrees. The UV index is 8, so it's getting moderately high. If you find a shade tree and you're under the shade tree will actually block a lot of the harmful UV lights, allow the infrared lights to come in. So you're getting the
Ah.
health benefits of infrared, but blocking some of the UV light. Other ways to do that, of course, is variable clothing and sunscreen. So depend on the time out, spent out.
Yeah, I see
Hmm.
all the outside workers, they always have long sleeves on even though it's
Hmm.
110 degrees outside and you're like,
Hmm.
"Why are they doing that?" It's usually
Hmm.
for the sun
Hmm.
protection, right?
Right, exactly.
Yeah. Okay. Cool, cool, cool. And then the other half is you work with like the prostate cancers and stuff of that nature. And we've had a lot of conversations about this before.
Hmm.
And your thoughts on like testosterone optimization
Hmm.
and having prostate cancer, because a lot of
Yeah.
times like that kills all your testosterone production, right?
Yeah.
And then going through the chemo is going to be bad for that. And then,
Yeah.
so like, what are your thoughts like on how that goes hand in hand?
Yeah, well, prostate cancer, what's interesting about it is that, well, one is a lot of men will get it. We know that somewhere about 13% of all men will get prostate cancer in a lifetime, and about 2.5% of all men, of these men, will die from prostate cancer. So it is one of those cancers where you can die from it, but a large majority may die with it rather from it. But then we're trying to prevent not only death, but what we call any kind of harm or morbidity, from the prostate cancer. When it comes into like the cause and the prevention, science is still trying to work those things out, but we do know that there's large roles in environmental toxins. Even mind-body connection has been related to higher risk. There's a huge correlate to diet, and we know that from different country studies. So, for example, The United States, we're not the top, but we are one of the higher rates of prostate cancer. We're pushing about 120 men per 100,000 men. But if you look at other countries with lower rates, a lot of times you're going to see it like the Southeast Asia, they are pushing about 3 cases per 100,000 men. So 3 versus 120 is a big difference, and a lot of that is environmental exposure and diet as well.
Yeah, and speaking of diet, like we've talked about how obesity's kind of passed up smoking even
Mhm.
as
Mhm.
probably the main driver for cancer nowadays.
Yeah,
And so can you talk a little bit about that and
yeah,
like how prevalent that is in society? Because that, I
yeah.
mean, is one of the easier fixes is to lose weight, but is one of the harder ones too. Like,
Right.
once you're really far gone, and so you got to really
Yeah, yeah.
focus on
And
that.
I'll try to loop back. I think I skirted the question on testosterone. I'll loop back to that, but then talk about obesity too. But, smoking for traditionally was always the top reason for all cancers. And the 90s and early 2000s throughout America, we had a lot of new social initiatives for smoking laws. And we have seen a dramatic reduction in cancers related to smoking. And so as people are smoking less and less, those cancers are going down. But what's overtaken it now is diet and obesity. So as smoking's gotten better, diet obesity is getting worse. Now over 70% of our diets average processed foods for the average American, and only 1 in 25 Americans actually meet dietary guidelines, USDA and FDA guidelines of minimal dietary recommendations for quality of food that they're eating. So yeah, so that's pretty critical. It's just us changing our diet, getting more whole foods into our diet, and that ties into testosterone as well. And so it's still being worked out, but traditionally we felt like too much testosterone caused prostate cancer. But what's interesting is some of the men with the highest testosterone are not at the highest risk for prostate cancer. Sometimes it's men at lower testosterone levels.
I
And
see.
so that can be really confusing because a lot of our treatments lower testosterone levels and the cancer gets better. But we also have studies that show that some men, not all, so I don't tell men to rush out for testosterone, but some men that supplement with either testosterone or estrogen can actually slow down prostate cancer growth or reverse it. Now, when I say that, I don't want anyone to take those because we're still doing clinical trials trying to figure out, what is the optimization for that. But
Yeah.
right now, the gold standard is to lower the testosterone. But if you loop that into diet, the way that I look at it is the differences between free and bound testosterone, and throw in a hormone called sex hormone binding globulin.
SHBG.
Yes,
Yeah.
exactly. So the more sex hormone binding globulin you have, you get that from eating a lot of high fiber foods. So I'm like the high fiber guy. I'm always telling people eat more plants, eat more
Chad
fiber.
is always yelling at me, fiber, fiber, fiber.
Yeah. So, but the more fiber you get, the better your sex hormone binding globulin, the better your control of the testosterone levels in your body, and you can still boost your testosterone through a good diet, pelvic floor exercises, and adequate sleep, as well. And so, yeah, so you can still have good testosterone, good health, and lower your prostate cancer risk just by eating more fiber. And so that's one of the biggest messages I like to get across.
Yeah, so Chad,
Mhm.
since you mentioned fiber and since we're talking nutrition now,
Mhm.
let's break it into cancer nutrition. And
Mhm.
so the me and Chad look at nutrition from two different lenses. He looks at it through like the cancer lens, right? So he's treating
Mhm.
patients all day. And when I look at it, someone comes into me, I'm looking at optimizing, fat and muscle gain, or muscle gain, fat loss. Sorry, not,
Mhm.
definitely not
Mhm.
fat gain,
Mhm.
but actually, depending on who you are, right? I've had
Mhm.
a few of those, but I
Mhm.
would say that his lens is going to be a little bit of a different approach.
Mhm.
But
Mhm.
I think there's a ton of crossover here,
Yeah.
and so I mean, the
Yeah.
first and foremost, just whole foods, right?
Yeah, yeah, whole foods. I mean, almost all nutrition guidelines and cancer guidelines are just going to tell you that the bulk of your diet should be whole food plants. Those are fruits, vegetables, beans, nuts, whole grains, and then minimal processed foods. And then when you're eating meats, you just want to get quality meats, lean meats, and sometimes moderation, depending on the meat. And there's a little bit of nuances that we can always get into as far as use of oils and cooking temperatures can sometimes play a role in that as well. But I personally take it a step further because I see such a powerful benefit of plants that I've actually in the last 5 years converted to what's called a whole food plant centered diet. So I virtually eat no dairy, no eggs, almost no meat, and very rare processed foods. I usually quote that I'm somewhere between 95 to 99% of my diet is just whole food plants, and I'll cook them and eat them in different ways, but I'm not so strict as to like shame myself if I have a steak or a chicken or like a Snickers bar or something. I just try to limit it as much as possible.
Yeah, because like I
Hmm.
mean, we're not all going to be perfect on any diet ever, right?
Hmm.
And so like we got to play for some of those, 80/20 though. Live your life, enjoy your life.
Hmm.
You can have a drink or you can have, a piece of cake here and there, but yes, if you overdo it, you will have bad health outcomes.
Yeah.
As just,
Yeah,
you
exactly. And
kind of
that's
know.
and it's hard to do what I do because I kind of take things to extremes. I don't expect that on patients or people, but I do think it's a better way, and that's why I do it. Although I do think the 80/20 rule is a great rule. It came off as more of a philosophy and then kind of a trend in doing a lot of different habits, but it holds true in a lot of different areas and holds true, I think, in diet as well. A lot of studies showing if you're getting close to that 80% whole food plants, you're going to be in tremendously better health, even if the 20% else that you're eating is not the greatest of health.
Yeah, and I look at it from like an addiction point of view where like, hey, like it's if you tell someone that they can't have something, like if you prohibit alcohol,
Mm-hmm.
prohibition,
Mm-hmm.
then people go under the table and they'll find their way, right? And
Yeah,
they just will
yeah.
lie to you and won't tell
Mm-hmm.
you about doing it, right? And so I'd
Right.
rather you
Mm-hmm.
cheat a little
Mm-hmm.
and then
Right.
do mostly right and let me know and so I can be
Mm-hmm.
aware of that. And so if
Yeah.
becomes more problematic, we can
Mm-hmm.
address it, but that yeah.
Yeah, no, I completely agree. It is, what another question in cancer is, is alcohol safe? And unfortunately, based on our best studies, we have to say that not even one sip or two sips of alcohol is considered safe. All alcohol is associated with a cancer risk. But it's very minimal, the moderation you do and the way you drink it and how you eat, consume it. So like for me, I'm gonna say I still like an occasional bourbon, but I will try to have food on my stomach, some salad on my stomach, because I know that's going to help protect me from some of the harmful effects of alcohol. But I can still enjoy myself, every once in a while.
Yeah, I always drink a glass of water between drinks if I ever do.
Hmm.
It's just diluted a little bit, and it does tremendously help you not get hungover the next day.
Hmm.
So,
Yeah.
yeah, electrolytes and
Hmm.
hydration, add that in the
Hmm.
mix. But
Yeah.
speaking of other possible causes of cancer,
Hmm.
other than like alcohol or diet, like what are some of the things that like environmentally could be causing us problems or causing cancer?
Yeah, so one of our biggest concerns, and you'll probably see in social media a lot, is plastics, in our food, and we're
Oh
learning more
yeah.
and more. Like if it may sound gross, but if you dissected us and you try to measure the plastic in our body, we're finding plastics from head to toe, brain, even our organs, appendages, skin, all over our bodies, and we're getting that from different, exposures. Could be the water bottles, could be, the microwave. It's a big unknown. We know we're getting it. We know it's in our bodies. We know it's in all animals that we eat, and even a little bit of plants we eat. It's higher concentration in animals, little lower concentration in plants. But plastics have been shown to be called what's called endocrine disruptors. You can learn a lot about it by going to a great nonprofit organization called Environmental Working Group at their website ewg.org, and they'll explain it. But it's a known, it causes changes that are known to promote cancer. We just don't know the toxic dose or quantity of it. We know it's bad, but we don't know how bad. And plastic is so endemic in our society. I think it's going to be very challenging to figure out how to get rid of it. Although there was a recent study that showed foods like oatmeal, high fiber foods, actually help withdrawal and take plastics out of our body.
Oh, they like kind of like latch
Hmm.
on, kind of like
Hmm.
a activated charcoal would grab
Hmm.
problematic fungal stuff, and yeah,
Yeah,
okay,
exactly, exactly. So there's hope that we have solutions, that are around the corner. We just need to look for them and practice those healthy behaviors.
yeah, and stop drinking out of plastic water bottles if you can.
Yeah.
Every once in a while, it's not a big deal, but like for the most part, like if you can get a refillable bottle, that is ideal.
Well, like everything in life, like you don't, you can die of dehydration a lot quicker than cancer from lack of plastic water from a plastic
Exactly
water
right.
bottle. So, yeah, so it's there are harms, but you always have to balance the risk and benefits of everything.
And so now taking it back to other things that could possibly cause cancer. And so, what are, I guess, the biggest ones you see that maybe are not talked about? That maybe, I mean, we know sun, we know like, is there like, Wi-Fi exposure, living in the city too long? Like, is
Yeah.
that like, yeah, stuff like that?
Well, we can, I can talk about known exposures. There's a big difference between known and suspected, and the level of evidence of those. And so we have to kind of be kind of cautious because sometimes we can go down this rabbit hole and blame something. And then later on we realize, oh, maybe that wasn't as bad. Or maybe we later on learn that, oh, that was a higher cancer risk than we actually realized. So we do know foods. Especially, processed foods, which almost any diet will limit processed foods or ultra processed foods, kind of defining those and the severity of them is where some of the confusion may come in. But the stats show that for every 10% processed foods that you increase in your diet, there's about 2% higher risk of developing a cancer. And so,
Okay.
so we have a lot of that data. The other foods tend to be, we do have a lot of data on actually processed foods and nitrosamine meats, which are kind of interesting. Some of those can be cold cuts. Some of those are your hot dog,
Spam.
sausage,
Yeah.
spam. Yeah. So those have some of the highest cancer risk. And
Dang it. I love a spam musubi.
and even though there's a lot of controversy on red meat, there is enough evidence of red meat, and that's going to be pork and beef. For too much consumption may increase cancer risk. One of the World Nutrition Societies tried to quantitate a safe amount, and they quantitated about 4 to 6 ounces of a beef steak once a week should not significantly increase your risk.
Oh, that's tough to tell my crowd,
I know,
Chad.
that is
yeah.
tough.
But
Yeah.
I appreciate you bringing it on there.
Yeah. No, you'll see like the main differences in me is I think that the most important thing in society is we are in a fiber deficiency crisis,
Yeah.
not eating enough plant foods. I think this is where me and Woody may disagree some, and most people I think would disagree with me with this. Is I think we're too obsessed with protein. I do think there's different ways to get protein. We do know that if you eat a healthy, more well-rounded diet and you're getting adequate fiber, that you actually utilize the protein you're consuming a little bit better. And then the debate really comes on what are your goals? What are your goals as far as strength training? Because the protein requirements are going to be vastly different for someone that's 80 and just trying to get back their mobility and walking versus someone that's 20 and wants to really get a lot of muscle growth.
And since you do lean into a lot more of the plant proteins, what are your thoughts on like the difference in amino acid profiles, right? So that we have this thing that's like a Diaz score. Basically, it's an amino acid scoring where they basically the optimal would be like they grade it off an egg being 100, and then because it has like this certain amino acid profile, and then every other food is judged off and based off of that. And so eggs being the baseline, and then like things like whey protein, like if you took like a protein drink, that's going to be like a 114, right? It's really highly absorbable, and it's got all the amino acids. And then you look down the list, and then the plant proteins come a little bit lower when it comes to amino acid profiles. So like when we do eat plant proteins, we got to eat our rice with our beans or something of that nature, right?
Yeah. So I'll give you my opinions, but I will verse it and say that these are just my opinions. We still need a lot of research, to try to figure this out. And these are my assumptions based on what I see. One key thing that a lot of people don't realize is virtually, with very few exceptions, every animal-based food and plant-based food has protein in it and has all amino acids, including essentially amino acids. So if I tell you eat a banana, yeah, you may be surprised to hear that a banana has protein in it.
Like one
And,
or sub 1 gram.
It's super low.
Yeah.
It's super low, but it has all essential amino acids in it. So that's one thing to know. So you get protein through all your diet food. The only thing that won't have protein is like oils, but then it comes into the quantity and the amino acid profile. So we know for bodybuilding that leucine and methionine, lysine are some of the most critical amino acids for hypertrophy and the speed of hypertrophy and absorption.
And that's your branched chain amino acids, right? So those are the ones that they try to sell you on products. Like if you go buy a can of energy drink and it says BCAA on the side, that's your branched chain amino acids. And by the way, guys, don't buy those on the store. It's probably a waste of money. If you're eating enough protein, you'll probably get all your BCAAs. So
Yeah, and
unless you're on
Yeah,
A vegan diet,
yeah. Well,
possibly.
there is study though that BCCAs actually can reduce cognitive function too. So there's some harmful effects of getting too much of them. So
Yeah.
everything is the yin and yang of life. We want the right balance of everything.
So EAA,
Uh,
not
mhm,
BCAA.
yeah, yeah. So I personally I try to even though I'll do supplements, I try to limit those and try to say, hey, how can we get the most from our diet? And so, in my opinion, plant-based proteins have the perfect profile, whereas animal-based proteins do have the higher muscle growth proteins. But the difference is when you're looking at muscle growth, it is minimal improvement, in my opinion. It's very small improvement for muscle use. But what I'm most concerned about, not so much muscle growth, but anything that is what we call a pro-growth food. And here's my theory: is that pro-growth is whey. It's casein protein. It is also going to be a lot of animal-based proteins and eggs. All these pro-growth foods, in some studies, show they can promote cancer growth. Now, most of these, though, are in preclinical trials and animal studies. We don't have sufficient evidence in humans unless you reach to large, long term correlation trials where they've been following people for a really long time. And then you do see a difference in lifespan and cancer risk over some years. The the overall difference is actually not that great, but that's my concern, and that's why I stick to more plant-based proteins.
Hey, to each their own. Yes. I mean, not everybody has cancer. And so, but even minimizing the amount, right? And so, like, a lot of times people on like a carnivore type diet, like, if they don't look at the macronutrients that they're eating,
Mm,
they would realize that they're eating an exorbitant amount of fats. And I don't know
mhm,
if that necessarily is always going to be the healthiest for you. But I also, talking to my last guest earlier today, we had a physical therapist on the podcast, and for better physical therapy
mhm.
outcomes, he said that a lot of people go on a short-term carnivore-esque diet where they go super high protein, and then they recover faster from their injuries. But I know that that is not necessarily what Chad would want. So, what are
Yeah.
your thoughts on that? And like,
Well,
yeah,
I look at the baseline diet of eating whole foods, lean animal proteins, just watching quality and lower processed foods. But any other fad diet, that be it carnivore, paleo, keto, each one of these has very specific roles, and you can use them as tools to try to get certain health benefits. But I look at them as being okay for short term goals, but they're all proven to not be good longevity diets, and they're all proven not to be great for cancer risk as well, or cardiovascular
yeah.
risk or dementia risk. So all of those diets show higher rates of cardiovascular, heart attack, stroke, dementia, and cancer, and people don't live as long. So I
Yeah.
don't deny that short-term benefits of like a carnivore diet
As like a reset
is
diet.
like a reset. It's kind of like a what we call an elimination diet. Elimination diets when you limit your amount of foods, limit the amount of irritants and allergens, allow your gut to reset, and sure with the higher protein, you can get more muscle mass, but a lot of the studies, you'll see it's pretty small in my opinion. So that's why I don't promote them very often.
Yeah, and that it's all priorities, the lens
Mhm,
you look through, but I think
mhm,
that it's valuable to tell the people like exactly
mhm,
what like you
mhm.
would recommend as like a medical professional too, because like it does matter when
Mhm.
you
Yeah.
see this every day and you know
Mhm.
are talking to
Yeah.
people that have had these lifestyles beforehand and then they
Mhm.
come to you for help
Yeah.
afterwards.
Yeah, definitely. I mean, and a lot of it comes to weight loss. Weight loss is one of the hardest things we can ever do, and we're all looking for that solution. And sometimes that easy solution, that pill, that supplement, that diet, that's going to help with the weight loss. But when it really comes down to it, there's really some core principles that usually span a lot of the psychological, mental health aspect of behavior changes, which I know are super challenging, super hard to explain. But then also, we know for diet and weight loss, you can lose weight on any diet, any food. Even if I told Woody to eat like Oreo cookies only diet for a month, I could make him lose weight as long as the calories are low
As long
enough.
as we match the calorie balance.
Right.
Yep.
So yeah, but those are probably may not have enough time to really hit all those those aspects, but yeah, I can see why people are always kind of searching for how can we feel the best, how can we be the healthiest, how can we maintain a good healthy weight. Those kind of led to a lot of our discussions about overall health and some of the goals we have and challenges we have.
And so a lot of these patients are undergoing chemotherapy, right? And so managing chemotherapy is hard, right? And so are there anything that you recommend physically, like physical, like doing cardio or doing something specifically for managing, your.
Yeah, so, going through chemotherapy, one is I always have to assess people's abilities, but I do know that individuals that can do any type of activity, exercise activity, drink plenty of water, and eat the same diet that I recommend, more whole foods. So plants help lower risk of nausea. We also see some better outcomes with certain treatments like immunotherapy. Some studies out of MD Anderson in Houston showed over a 20% higher response rate to people that ate 30 grams of fiber or more in their diet that were on immunotherapy. So I coach a lot of people through that. There's still debate on fasting around chemotherapy.
Yeah.
It's interesting. There's some positive findings, but it's in a very small amount of patients, so it's hard to make that a standard recommendation right now. And I tell people to be very cautious if they have cancer and are undergoing chemotherapy with any kind of fasting.
Speaking of fasting, well, I was gonna say during chemo that you said that specifically, but like, what about fasting for cancer? Basically, prevention overall, right? Like, is there not like a good benefit from autophagy from doing like a fast so that is cancer preventative?
Yeah, well, we know you can get autophagy through both exercise, and it's probably easier to get it through exercise, but you also get it
Yeah.
through fasting as well. So autophagy and benefits, anti-cancer benefits, are seen in fasting. They are seen in a lower calorie diet overall, like not overeating, and but it and then also in exercise. But from what I see everything as an energy balance. So if you're eating too many calories, you need to expend it. You need to be
You need to use
exercising.
your energy. Yeah.
Right. If you're not using it, where's it going to go?
Build up on you.
Yeah, build up, cause fat, and then cause a lot of hormone disruption, metabolic dysfunction, and that's where you start seeing cancer growth. And so that goes into the theory. Cancer theory of etiology has a lot of different theories, but metabolic theory is one that's very valid. And so, so that's have to take that into consideration.
Yeah, and then other people also that have cancer, they watch like Joe Rogan and they watch other podcasts on the internet and they hear about people talking about ivermectin and methylene blue and these like alternative cancer drugs, like or even a broccoli shot. Like they have like
Yeah.
all these different things that people are trying to do on the like cancer prevention and alternative treatment styles. So what do you think about those and like what is your
Well,
take?
I mean, this is my kind of my overall take. Is one is that, all of those treatments and a lot of other treatments, they're all still in the experimental phase. Like we don't really know if a drug works unless we've studied it in enough humans, ideally against a placebo, and try to figure out if you're getting a benefit in humans with cancer and quantitating that. Now, that goes into a lot of our clinical trials. Most of those, unfortunately, they tend to be novel drugs, which is good, and they're funded by a lot of wealthy pharmaceutical industries too. But they have each clinical trial. It's estimated each drug that comes out has about a 5% chance of making it to FDA approval and actually being beneficial for patients. And our enrollment in clinical trials in America ranges from 3 to 5%. So we actually have a really hard time convincing people to do clinical trials. Now, for drugs like ivermectin, methylene blue, infrared light therapy that may have potential for anti-cancer benefits, they're not proven, and we have no human studies to really solidly prove them. That's not to say I do think there's promise in them, and this is where I put it out there. If some billionaire, Elon Musk or someone wants to give me
Yeah.
$1 billion and allow me to run these clinical trials, so we need a lot of wealth and money to run clinical trials on people to track their data, to use ivermectin and methylene blue to see if they work, and a brilliant scientist to come up with usually combination and lifestyle therapy. Because with cancer, we see the best benefits is when we attack it at multiple angles and we use a lot of different techniques. So yeah, so I have to work in the realms of what's safe for people and what's known
And what's studied?
and what's studied. And so so I don't prescribe ivermectin. I can't promote it. I've had many patients take it, dozens and dozens. I've never seen a correlate benefit from it yet. But that's not to say there's not a benefit just because I haven't seen it. Like I'm thinking that well maybe in the right combination, the right setting, it could be a benefit, but we're never going to know that unless we do human studies. But right now, what we believe, what everyone sees is on social media, anecdotal evidence of benefit. But any one individual could say anything works and promote it, and that's meaninless as far as data goes. It's
Yeah.
great for emotion. It drives our emotion. We're like, oh yes, that's going to work for me too. But just because my friend or my neighbor did it and it worked, that has no bearing or impact on you or your cancer, whether or not it's at work. So that's where the benefit of science comes in. But science requires funding, it requires time, it requires participation. And unfortunately, in America, we don't have the funding, people don't have the time, we don't have the participation. So a lot of us, over 70 to 90% of Americans, are experimenting with things like ivermectin, like methylene blue, but with no way to track it. So that's another thing out there. I'd love for someone to help me build an app or a way to track it, get all these people to track their data to try
Yeah.
to find correlates to see if it actually works. But I'm not a computer science guy, I'll throw that out there if anyone ever wants to contact me.
Well, I think that like there should be an app about this stuff. Like I
Mm.
have other patients who have so many questions about their cancer, and if there was a social media out there that was like, "Hey, I have mast cell cancer, or
Mhm.
I have breast cancer, or I have some the BRCA gene, right?" Like,
Mhm.
and those things that they can relate patients to, and they can put you in communities together. Because if they had something like that, then I wouldn't be getting all these questions to me. They'd
Right.
automatically be answered because they would
Right.
know where to go.
Yeah, yeah, definitely. And there's a lot of different aspects that I had, that to it, like the medical legal. Like you got to make sure people know the harms, the potential risks, and the benefits, and trying to educate that on a mass scale and study it. It's. I think it's possible. It just would be a huge undertaking.
Do you think that the progression in AI is going to progress the entire medical industry really fast, or do you
Yeah.
think it still needs a lot more refinement?
Yeah, I no, I it does need a lot more refinement. Like I'm not afraid of AI taking my job anytime soon because cancer. Whenever you're assessing people as an individual, like there's nothing like the human touch of like knowing all the nuances and figuring out. But that's not to say big data incorporation and putting that all together. That's where AI I think it's going to be a tremendous benefit to the healthcare industry.
I completely agree. I think that it's gonna, speed everything up for you. Like as the
Mhm.
person, prescribing these things and like taking notes and doing stuff. AI
Right.
can just listen and then
Hmm.
create an entire,
Yeah.
workflow for you for the rest of the
Yeah.
day.
Well, people don't realize, as an oncologist, I may work 80, 90 hours a week and I'm seeing patients half of those hours, and so the other half of the hours I'm writing notes, I'm calling people back, I'm talking to other doctors, I'm reviewing, imaging labs, tracking down labs, calling patients back, and then doing notes. And the note taking part is very time consuming, but we are now piloting some AI programs that will actually write our notes for us and actually enter a lot of our orders into it. And I'm guessing that could possibly save me at least 10, 20 hours a week, possibly, if that works out.
That's huge.
Hmm.
Yeah, and then I mean, we can give better care to the patients. And so we are running up on our last like 6 or so minutes here, but I do want to ask you, like, what do you think that we can do better in like the health industry for cancer prevention and cancer treatment nowadays?
Yeah, so I think the biggest keys are, we are still lacking a huge lifestyle medicine component, and not only cancer but health in general. And so we really need every physician or provider or grouping to really focus on those core things of sleep, anxiety, mind, body, exercise, and nutrition. And so when we focus on those things, we are going to optimize our treatment programs and optimize people's health. And the part of the problem is none of us are trained in it. There is a fellowship program in it. A lot of people can do extra training, but for physicians, there's not a lot of incentive to do that unless they really have a passion for it.
Like you don't go through diet school like the
Right.
entire time. Like that's very little talked about. They're trying to specialize you in
Mm-hmm.
oncology and
Mm-hmm.
cancer.
Right. Like our incentive programs, unfortunately, like I make less money for actually promoting these ideas because if I did not talk about lifestyle nutrition and I just said, here, take this pill or take this chemo, and then if you don't do well, come call back, that would spend a lot less time with patients or individuals. And, the more, we physicians get compensated based on, time and quality. So the more that we unfortunately add to the patient's care, it doesn't always equate to incentives. So it's hard to motivate physicians in general, to do this when the whole structure of the healthcare system's kind of messed up.
Because it's a business. It's not
Mhm.
necessarily. It's run
Mhm.
like in a way that
Right.
is, how
It's
can we make the most money or hit our quotas or do
right.
something? How do you improve on the business year after year?
Right, right. And it's and some, it's a business aspect, but then it's also an education aspect. So we're doctors are getting squeezed more and more. Payments are getting worse and worse the longer that we're in practice, and then the incentives to actually talk about all these other health things are not matching. So how do we get to go from what we call sick care in America to more preventative care and holistic whole body, looking at the whole body care. And the thing is we do have a lot of areas in functional medicine, integrative medicine that are incorporating these, but it's not standardized. You're going to see a wide variety. Like the opinions that I give, I try to distinguish opinion from what we really know evidence based, because there's always, always ask your doctor too, like, is this your opinion or is this evidence based? Because you know, every doctor, we're influenced by social media and other things just as well.
You guys go home and watch YouTube too.
Exactly, and so, but we try to hold ourselves to higher standards, to give good quality information to patients and tell them the best evidence, and then we can still give their opinion. But I always catch the phrase like, "Hey, this is my opinion. This is what I think, but this is what the data, what we're told that is the best for you."
Awesome. Well, thanks, Chad. I appreciate you coming on here and telling a little bit more about our story. And I hope that the people learned a little bit today. And if you want to find Chad, he's over at Ironwood Cancer Research Center. So if you do have cancer, I would go there. And
Yeah,
then,
yeah, and I'm soon to be launching a pod. Not only it's going to be more of a YouTube, also on Instagram. It's going to be called the Cancer Answers, and so I'm going to try to go over all these aspects of cancer prevention, treatment, and kind of looking at the whole lifestyle medicine, holistic and integrative approach to cancer treatment.
thanks, Chad. I appreciate you coming on here, brother. And guys, we will catch you guys next week on The Price for Paradise. My name's Woody, and aloha.